next, we talk about the future risk and the follow-up for the parts for the patient. Okay, so this might be a long answer, but it depends actually. So she wants to know what is the future risk of having an ectopic pregnancy and what the follow-up management involves, as in the case of medical treatment. That was with methotrexate. You know, the follow-up appointments are really important, and in the surgical case as well. So we will discuss it in detail. So the information that we can give to the patient at this point is, again, I will explain it in detail, and then you can pick up a few sentences that suit you. Okay, so basically for most women, an ectopic pregnancy, it occurs as a one-off event and doesn't occur again. Okay, so it's not important that if you have had a ectopic pregnancy once, you will have an ectopic pregnancy again as well. The chance of having a successful pregnancy in the future is good. And even if you have only one fallopian tube, your chance of conceiving is only slightly reduced. You still have a chance of having a normal pregnancy. Okay? So the overall percentage, or the overall risk of actually having a second ectopic pregnancy, I think of having ectopic pregnancy somewhere around 8%, 8 to 10%. However, this again depends on the type of surgery that you have had, or any underlying damage to the tubes, and in the future pregnancy, if it happens and you conceive, basically you'll be offered an ultrasound scan at around 6 to 8 weeks, in order to make sure that this time the pregnancy is occurring within the womb. Okay, so as soon as 6 to 8 weeks, they will offer you an ultrasound. And if you don't want to become pregnant in the near future, okay, or if the patient is getting medical treatment, they shouldn't get pregnant for at least 3 months, then you advise the patient that please consult the family planning clinics or your GP and get some form of contraception that may be more suitable for you, okay, depending on the situation. Now, how is the follow-up carried out? Okay, so if she asks you about how will the follow-up be carried out, then depending on the type of management you have conducted, for example, if she was on conservative management, or that is the expectant management, then you can tell her that your doctor will need to check your blood levels for the hormone, which is HCG, okay, every few days until the normal levels are reached. And why do we need to do this? This is to ensure that the pregnancy has completely dissolved or ended. Okay, and you may need an ultrasound scan as well to further make sure, to further confirm. Now, if the patient is given medical management, that is methotrexate, then how you're going to explain the follow-up to the patient? You can tell her that so for methotrexate, you will need to return twice in the first week, and then once a week again to check the blood levels of the hormone HCG. Okay, and it may take a few weeks to ensure that the pregnancy has completely dissolved, and as with the conservative management, you will need some ultrasound scans to make sure that the pregnancy has ended. Okay, and during this time, till it is confirmed that the pregnancy has ended or not, you should not have any intercourse, and you should avoid getting pregnant by using a suitable and reliable form of contraception. It may include emergency contraception as well, for at least 3 months. Okay. Then if it is only about surgical follow-up or even, so surgical management, how do you carry out the follow-up in that case if the patient has been offered surgical management? So you tell the patient that You may be offered a follow-up appointment with your gynecologist, especially if you had an emergency laparoscopy performed, and if you emergency operation or laparotomy performed, and if you have not had your fallopian tube removed, you will need to have your HCG level checked until this is back to normal. That is the case of salpingotomy. So, yeah, this is what you tell the patient about follow-up. Now, whenever you are wrapping up this conversation of ectopic pregnancy with the patient, you always reassure the patient that however traumatic your experience of an ectopic pregnancy has been, it may help to know that the possibility of a normal pregnancy next time is much greater than the possibility of having another ectopic pregnancy. Okay, so this is very important to reassure the patient, to calm her down that her future pregnancy chances are higher than having an ectopic. And if you have any questions at any time, make sure to speak to your midwife, your GP, your gynecologist, this team, us. You will have the contact details of all of them. So the way you end this station and the way you reassure the patient is extremely important in this case. Okay, and you tell her that the possibility of a normal pregnancy next time is much greater than the possibility of having another ectopic pregnancy. Trust me, you will pass this station, okay, if you are successful in giving this information to the patient. Okay, this is the main idea. So, when you wrap up, when you've given all the information to the patient, you then always is the golden rule. You ask the patient if she has anything else to ask you, which most probably, in most of the cases, she won't. And you thank her and you finish the station. Okay? So the key points are that you need to be compassionate, you need to be sympathetic, empathetic, and which is actually true for all the stations in PLAB2 when you're breaking the news. And in this case also the patient will be vulnerable because it is an ectopic pregnancy, and as you all know, it is an emergency. So your body language, your choice of words, your expressions, the sympathy, the empathetic tone, it matters a lot. Always never rush the patient, never rush yourself. Be kind, be considerate. Giving more information is not the idea. As much information as you can with the flow, not too slow either, but as long as the patient is absorbing it and you are developing a good understanding with the patient, that's what matters more. The focus in this station in ectopic pregnancy is on the treatment. Okay, you can mention consent. Sometimes people say, do we need to ask the consent or not? You may mention the consent, but in my opinion, I don't think it's a very big issue. Just go with the flow, okay? But you may mention the consent, and always make sure that the patient is following you. Even if I didn't give many pauses, like while making this video, please make sure while talking to the patient, you give a pause, you ask them if they are following you, if they are with you, and then you carry on again. So this is it really about the ectopic pregnancy, and if you have any questions, if you have any suggestions for me, please comment and we can discuss and make another video about all the questions, and we can help each other develop more understanding about the topic. And if you have any particular topic you want me to cover, please do let me know and I'll be more than happy to help you around. Thank you very much. Bye, and all the best for your exam.